As far as that understanding, you mentioned that some people hemorrhoids and others are not good candidates. Are there other people with, let's say, irritable bowel syndrome or other things that wouldn't be good candidates?
Absolutely. We teach the whole list of contraindications. Certainly would never touch a pregnant woman.
Hmm.
We would never touch anyone with congestive heart failure. They're already having a difficult time shunting their fluids. Kidney challenges, all that fluid goes in. It's the kidney system that's also being flushed. If they can't uh, move that out, it could be dangerous. So these contraindications are important, and everyone is required to be medically cleared before they come to my school or come into my office. Because by license in Florida, Florida is the only state that has a license for colonics through the massage board. So I went to school for massage and colon. The other states we're doing what is called national board certification. But by license, I can't even take blood pressure. Uncontrolled blood pressure could be dangerous as well. So we have the lower thing and let them take it themselves as a way to stay in our scope of practice, maintain our professional boundaries, and make sure it's safe. But they should have already had a doctor check that and sign a release before they come to me. It's a good question. Thank you for that, because not everyone is a candidate
But it
for
sounds
colon
like
health.
a number of people with, because I feel that many people, whether it's diverticulitis, Crohn's, all these other issues, may say, well, I don't want to do that because I already have inflammation there, and possibly this may disrupt it more. So they kind of stay away from that. What would you say to them?
Well, I would say that my years of experience have shown that I have great success with IBS, irritable bowel syndrome, because this is a condition of the nervous system.
Hmm.
I am much more interested, Casper, in helping teach people how to relax and give them hydration.
Yeah.
This is the focus of our Shea Waves Flow Fill brand and exclusive methodology. IBD, inflammatory bowel disease, is another condition that very often when they're in flare up, they're in the emergency room.
Hmm.
I mean, they're having mucus and blood come out of their bodies. They're in an acute attack, whether it's Crohn's, colitis. Diverticulitis is actually not in that category, but it could be, depending on the literature you read. Diverticulitis is when there's a pocket that bursts, like a little bubble that comes through and the feces hangs out in that little pocket. And with time, it can just putrefy and create an infection. I have seen the little marble balls come out of my own body because I have been diagnosed with diverticulosis, which is the condition of having this. Most people do, especially between 50 and 90. It's just what I call normal wear and tear, like the aches and pains of my knees and my hips and all that other stuff. And the silver hair, it shows I've been around. Okay. But I've been washing those little pockets out of my body once a month. I give myself a colonic. I'm preventing the itis. So diverticulosis is the condition of having the pockets, very common. It's when the infection occurs, diverticulitis, that they need medical care. So we would never work on anyone with an acute condition like that. They're going to be in a lot of pain. They're going to need medical care. And yet, just yesterday, I found research from Queensland, Australia. They have isolated 5 bacteria in the microbiome that not only reduce the inflammatory condition with IBD, but they excite the anti-inflammatory natural killer cells. This is the kind of stuff I read because I'm so excited that they're finally going to, isolate these 5 somehow and create a nice little nutraceutical out of it. That's a fancy name for a natural pill. And hopefully that'll get to the marketplace so that these people won't have to suffer. And if they take these 12 gut irritants out of their diet, they'll feel better already. They'll lose a little weight. The belly fat will go down because this is the marker, right? The abdominal fat is a big marker for metabolic syndrome. So these top 12 gut irritants is where everybody starts when they work with us. And this we learned from Thomas Rowell, of course. Don't
Right.
even think about dairy or sugar or alcohol and gluten, forget it.
Yeah, well, that's a big part of everyone's diet these days are these irritants, right? So much of it. So of course, it's incredibly important what we eat, and like you mentioned, how we eat as well, in a parasympathetic state that allows us to digest well. So that's incredibly important. Something people miss, only focusing on what, and then eating stressed out, not with gratitude, in a rush, not chewing, all these things.